Did I just see the wonderful Elizabeth Booker while I am going off on this whole Diddy trial and how all them women were treated and some of the male sex workers, girl? Like,
Man, look, and I'm the wrong lawyer for it because I don't know nothing about criminal law. I don't know nothing about criminal law. I've been following the case just like everybody else, not like an expert whatsoever. I
girl,
am sitting here
me
just like,
too. And
wow,
Toure has been doing a really good
just in
job kind of
shock.
like breaking this down, not necessarily from a legal standpoint, but just being a good journalist. And some of the testimony from the women, I'm just like, y'all needed those Chanel bags.
Mm-hmm.
I mean, like, there was a huge level of trauma and abuse. There's that. But then
I
there's
don't need a
also
bag that
choice.
bad.
So there's
I don't know.
choice and then there's trauma and abuse. And I'm just trying to figure out, I'm just trying to sort through all of my emotions about it, because I've definitely been in abusive relationships and it ain't that easy to leave, especially when you have celebrity dangling over you and a very dangerous person also, involved. So I'm not trying to blame the women. But man, this is a lot. So, are you still on the Hill list? Hello.
Okay, so it looks like we may have lost Dr. Haynes because of the Wi-Fi situation. So I'm just going to pop on, if that's okay with everybody, and talk a bit about
Hello.
why I'm here. It's not about the Diddy trial. Like I said, I'm following it just like everybody else. That's not the kind of law that I work in. I'm actually a public health lawyer,
Liz?
and I also work in privacy law for health systems. And so what's going on right now with these Medicaid cuts, with the bill that was just passed in the Senate and is now back in the House because of the edits that the Senate has made. That's
Hey,
what I'm here to
thank you
talk
so
about. Hey,
much for
Dr.
being
Haynes.
here
Hello,
as we have been down for
Nola.
3 weeks. We had to up our game. Now we're on StreamYard. We were on Instagram Live, but we've taken it to the next level, and I'm so excited about this relaunch. And when the team was talking about who can be our first guest back, I was like, it has to be the amazing Elizabeth Booker Houston. So thank you so much, sis, for joining us tonight. I definitely want to dig into this big ass ugly bill, and then we're gonna talk a little bit about you, and then I want to talk about this. I'm really kind of like I've been asking a lot of guests about this idea about new media and what that means. And I noticed when we were chatting earlier, you were very intentional about saying you're a political commenter and not a political influencer. So I want to unpack that a little bit at the end too. But let's dig into this big ass ugly bill. What is going on?
So, what we are seeing, first of all, we know that this bill has passed the House some weeks ago. And we know that the bill at the time had roughly $800 billion dollars in cuts to Medicaid. And I was actually at the Capitol the night that they were trying to push against the passage of the bill. So, doing Votorama, which people have heard about in the last few days, but I'll explain that in a minute, where they were trying to push the vote to not pass this terrible bill. We got breaking news in the middle of the night in the Capitol that I reported on, where they found out that because of something known as the pay-go rule, it not only affected Medicaid, but would cut $500 billion dollars from Medicare. And that doesn't even cover all of the things like with removing the energy credits from the Inflation Reduction Act that's going to make working class families' electric bills increase. Talking about veterans benefits, talking about the $18 billion dollars in cuts to NIH when it comes to cancer research, pediatric cancer research, so many horrible things in this bill, all in an effort to
Mm-hmm.
give a tax break to the
Mm-hmm.
0.1%, not the 1%, but the 0.1%. $300,000 for each individual, which is wild to me because one, these people do not need it. We do not need to make rich people richer, especially people who are so disgustingly rich that they are the 0.1%. Second of all, these working class families all across the country rely on this. Um, so unfortunately, it passed in the House, went to the Senate, and now what we saw was a big showdown of delays on the bill. And they made different amendments in the bill, and that includes the Senate not now saying, "Oh, we're not going to cut $800 billion
Oh
dollars
my.
from Medicaid. We're going to cut over $900 billion dollars." So they made it worse. And there's a ton of other provisions that we're still finding out about because they kept doing these things in the dead of night, when insidious things happen. But they always say what's done in the dark will come to the light. So it's coming to the light now.
Mm-hmm.
They passed it in the Senate. One vote. One more vote from a Republican, specifically Senator Lisa Murkowski from Alaska, would have stopped this bill from going through. We saw that Senator Susan Collins, Senator Rand Paul, and Senator Tom Tillis, all Republicans, all voted no. One more no vote would have saved it because we had a 50-50 split. And of course, that meant that Vice President J.D. Vance got to come in and give the tie breaking vote so that it passed with 51 votes. Now it goes back to the House. The president does not sign it into law. It is not law yet. And that's because of the amendments and changes that were made in the Senate. So now the House has to take those up and reconcile those. It can be done different ways. They can split some of those to their committees and they can consider it there. They could address it through something that's sort of like a committee conference where they kind of work with the Senate to reconcile this bill. There's different ways they can go about it. I don't know just yet how they're going to go about it. I do know that word on the street is the House is trying to push for a vote tomorrow. So whatever's going on, they're trying to move quickly. And that's where we are. That's the state of it right now. So we're trying to now put pressure on the House reps to vote no on this bill. There's 22 Republican representatives in particular who seem to have kind of shaky, whether seats or they live in more purple areas, who are more movable on this issue, who are iffy about it already. And of course, even after it passed in the House, we saw some things happen, like Marjorie Taylor Greene admitting that she didn't read portions of the bill. The bill includes a 10-year moratorium on states being able to pass any laws regulating artificial intelligence, taking away states' rights and state power to do that and do what's right for their citizens of their states, their residents of their states. And she admitted that she didn't even know that was in there because, of course, she didn't read the bill. It's almost 1,000 pages, and they were pushing it in the dead of night. So
Well, thank you
that's
so
the
much
quick
for
and
that
dirty
breakdown.
summary of where we
I
are with
was
this.
on the Hill a few weeks ago where Senator Klobuchar held a hearing about how this bill will impact women specifically. And I saw that you recently talked to her too. So can you speak a little bit about that? As we are the Persist Network, this is women powered. We have our Persist guys in the background that are lovely and help us do this work, but Persist is a network for women built by women. Can you speak a little bit about how this bill will specifically hurt women, things like the reduction of SNAP and, things that hurt people at the kitchen table. Can you speak a
Yes.
little bit about that?
Absolutely. So first and foremost, the cuts to Medicaid. We know that almost half of pregnant women in this country rely on Medicaid to give birth. That is how we have safe, healthy births in this country for half of the pregnant people here. And for a party that seems to be so pro-life, it's crazy that they want to cut a benefit that helps us bring healthy children into the world. So that's a major one, and also just women's health in general. We are also seeing that they are trying to potentially make cuts in places where that's going to impact women's health specifically. So these cuts are estimated to really hit home on specialties.
Mm-hmm.
And a lot of folks include OBGYN in that. Even though for us, that's routine care. But because, of course, we frame everything from the perspective of men in this country, it's considered a specialty. It's just such a mess. We're also seeing that with SNAP, the cuts to SNAP benefits, which of course will affect women who, very much, especially mothers, use those benefits to feed their children. Again, just taking the food out of the mouths of babies. I can't. I truly cannot understand it. We also know that when it comes to elderly care, that women are far more vulnerable than men. And we're going to see that about 1 in 4 nursing homes, and you have that chart, which is so beautiful on the screen. 1 in 4 nursing homes will close because even if you don't rely on Medicaid as an elderly individual directly for your care, maybe it's Medicare, which again, I want to remind folks that because of the PAYGO rule, we are seeing also $500 billion in cuts to Medicare.
Mm-hmm.
But the majority of nursing home funding is through Medicaid. And a lot of people don't know that. So that's what we're seeing, especially with the focus on women in our reproductive years, women as we age. There's nothing good about this bill.
Thank
Nothing
you so much for
whatsoever that
making
is
that
good,
distinction. And
especially
this is the
not for
last
women.
thing, we'll say, because I definitely I want people to get to know you a little bit better. But the last thing that I will say, when my mom was dying, she's a veteran, and the veterans facilities for people that were near the end of their lives, for veterans in Los Angeles, were horrific. And if it weren't for Medicaid, my mom would not have been able to be in a facility in Santa Monica to where there was a level of dignity, that she had being in a place that, for one, was clean, you know. And I just remember going through this process with her because it's so expensive to take care of our aging parents. You know, I wasn't making enough. Her insurance wasn't enough. It took all those things together for my mom to spend the last, months, year of her life in a place that was clean, where she met people, they had activities, it was in a nice area where she felt safe. So when I think about this, I think about it from the perspective of a caregiver as an only child, and how Medicaid was able to give my mom some sort of dignity towards the end of her life. And I know I wasn't the only caregiver out there in that same situation. So thank you so much for breaking that down.